And welcome back to Talk of Alabama. We are now joined by Dr. Jeffrey Dugas with Andrews Sports Medicine and Orthopedic Clinic, and we're talking about the injuries that most people have had at some point or another, baseball and softball injuries. So many people grow up doing this and then obviously go on to do this in college, high school, and professionally. It's a big deal, isn't it?
It is a big deal. We see a lot of people going on and playing at different levels. There's a lot of opportunities for kids to play at further and further levels with junior colleges and college opportunities. So yeah, it is. There's a lot of opportunity.
What about for pitchers? What's the biggest injury for a pitcher?
You know, the common things that we see in throwing athletes, pitchers, and baseball being the most demonstrative one, is elbow injuries. We see that a lot in younger kids. We see little leaguers' elbow injuries, which are injuries to the inside part of the elbow. And then as they grow older, we see injuries to the ligament, the main ligament in the inside of the elbow, which is the Tommy John ligament, the ulnar collateral ligament.
So many kids out there, though, want to pitch, and they do pitch. What can parents do that are watching to help prevent these injuries, or is there anything?
You know, there's some general rules of thumb that are great to follow. Some of them include not throwing year-round. You should take a break from pitching. You know, if you pitch in the spring, maybe don't pitch in the summer. Play a position and hit and continue to grow as a fielder and a defensive player. We don't like them to throw breaking pitches before they're shaving. It's great to throw change-ups and learn how to change speeds and spot pitches and learn how to control the plate and things like that, but we don't want them spinning their wrists before they stop growing. So when their growth plates are done, then it's safe to start doing those things. We tell them to stay away from radar guns. You know, it's not important to know how hard you throw. In fact, if you go over about 80 miles an hour before your growth plates close, you have a much higher incidence of getting hurt. And while that may provide you a competitive advantage, if you're 14 and you can throw 80, you're probably a really good 14-year-old. But you're also much more likely to get hurt throwing over 80 miles an hour.
When does the growth plate close? At what age?
It's variable, but for most boys it's around 15. For most girls it's around 14. So by the time they hit their first year of high school, most of them are done.
Most of them are done growing?
Most of them are done somewhere in their first year of high school. Obviously there are some outliers. Some people will grow into their late teens, but most boys are going to finish around 15.
And what are some signs of fatigue, you know, if...
Anytime we see a kid that they've been hurt, a lot of times they tell us they were having pain before the actual last throw.
Yeah.
We don't ever want them to throw in pain. Kids we tell them this is kind of a never event. You should never throw in pain when you're a kid, especially with open growth plates. Any pain during the course of throwing, you should stop that. And we should maintain arm strength throughout the throwing season. So if you're going to be a thrower, if you're going to be a pitcher especially, you have to maintain your arm strength throughout that season. That means doing a set of exercises that keeps your arm strong and prepared to throw. Otherwise, you're just constantly fatiguing your arm to the point where it's so weak you're going to get hurt.
Now, does this apply for softball as well, some of these rules and regs?
Interestingly, we all grew up hearing that you can't get hurt throwing a softball, and that's a little bit not the case. The windmill motion is a more natural motion, so it is less stressful on the arm to throw a windmill pitch. But a windmill pitch doesn't necessarily make it safe to do it 200 times a day, 3 days a weekend, 52 weeks a year. And we are seeing more and more injuries in the softball world, also with the overhand throwing that occurs in softball. Because a lot of them do throw overhand as well.
Now, you hear a lot of people, you talk about the speed ball, the curve ball, all the different tricks, so to speak, that are out there now. Advised, not advised?
I would rather see a kid learn to throw a fastball or 2 different fastballs and be able to change how the pitch looks to a hitter. Be able to change speeds, throw a changeup, which is the same arm motion, just a different grip on the ball. And that doesn't change the stress on the elbow and the shoulder. If they can learn those 2 or 3 pitches before they get to high school, they can be a dominant pitcher without throwing a curveball, without throwing a slider, without putting that undue stress on their arms. As they grow and their arms grow and their hands grow and get stronger, they can learn to throw those pitches safely if they're being coached properly and not put more stress on their arms.
And in closing, if somebody's watching this right now and they've heard their child, their nephew, their niece, somebody complain about pain, what should they do?
You know, if they're hurting while they throw, first of all, they should stop. They should not throw in pain. If that doesn't resolve in a reasonable amount of time, 7 to 10 days, something like that, they may want to get the opinion of a sports medicine specialist. Obviously, if they feel a pop in their elbow or their shoulder and they really can't go, that warrants an x-ray and kind of immediate attention. And in terms of the regulations and pitch counts and rest periods and things, those are all available on the American Sports Medicine Institute website, as well as the USA Baseball website and Little League Baseball baseball websites. Those are available. They're kind of universal pitch counts and rest periods that we recommend for youth throwers.
Okay, so if you've got more questions, andrewscenters.com. Also, for more information, there's a talented staff of doctors there that can help you from head to toe when it comes to your bones, your bodies, and everything in between. Thank you so much, Dr. Dugas, for being here.
Thanks, Nicole. Great to see you again.
We'll see you next time.
Thanks for having me.
Again, andrewscenters.com for more information. We'll got to take a quick break. We'll be back in a minute.